Does having chest pain indicate a heart problem? I'm Kim Loh, founder of Wellness Warrior Move. And when it comes to pain in chest, not all the pain in chest is heart disease, okay? The typical way of heart disease is sort of like this intense crushing pain, that sort of breathless crushing pain that travels down your left arm and up to your jaw. All right, but actually, a minority of heart attacks present in that way. For some people, especially women, women can present with heart attack differently than men. So it's important to keep in mind that all of those different ways that can be present. For some people, they don't even get pain. They might just feel like a little bit of breathlessness, all right? So it really depends, but it doesn't mean that every pain in your chest is heart pain. You have a lot of other things in your chest as well, right? You have your lung, you have your rib there, and you have your muscle there. And especially if you are a young person and you get this sort of sharp and stabbing pain in your chest, a lot of people have asked me before, does that mean that I have a heart issue? Not all of a sudden, I feel like I can't get a full breath because there's a sharp pain in my chest. It's not your heart. It's something we call precordial catch. It's 100% harmless, all right? Most people will get it, It's just like certain sharp stabbing pain and it's go away, okay? It's not harmful. For other people, it's just because, they bruise themselves and it might be a muscular pain in the muscle somewhere, all right? So it's not every pain in chest is heart pain. But one of the indicators of heart pains is another symptom that goes along with it. So the nature of the pain, what sort of pain is it? I heard people describe it's like weight pressing down on their chest. It's sort of like crushing pain. That's how I heard people describe it. Or they can't catch their breath anymore. They start feeling dizzy, not quite themselves. It's the other symptoms that go along with it and that make you start thinking that, it might be heart. And it's also the other thing as well. For example, people is 70 years old, diabetes, hasn't been taken care of themselves, has a history of like blood vessels problem in their heart, all sort of things. That you put it into together and make you think, that's my heart pain. It's not just 100% pain in the chest, it's pain in the heart, okay? So don't be too worried about pain in the chest automatically equals to heart pain. You have to look at all of the other things as well and all other things that contribute to make the full pictures of what actually is going on. Kim Loh here. Today we are talking about one of the myths about cardiovascular system. Does high blood pressure medication cause low sodium level? So high blood pressure medication, there's a lot of different classes of high blood pressure medications. One of the classes of high blood pressure medication is actually causing your heart rate to be a little bit slower. So it's a controlled heart rate. So another type of blood pressure medication is dilate your blood vessels, okay? So that you widen your blood vessels and lower the pressures. And there's another type of blood pressure medication, which it brings down the sodium level, which we call diuretic. And what is this medication does is it makes you pee more, you go to toilet more, and you will get rid of those excess waters in your body, which will bring down the blood pressure. But because you are going to the toilet so often and get rid of so much of water, how our body works is like, get rid of the sodium as well in order of get rid of the water. So if someone making too many trips to the bathroom, they could be losing excess of sodium along with the water from the body. So that is one of the things that can bring down the sodium level in your body. Another thing is that will bring down the sodium levels in your body are certain medication, not excluding heart pressure medication, but also other medication. For example, there are some other type of diuretics that might be used in other diseases as well. Or for Australians, the most common cause of low sodium is what we call idiopathic hyponatremia, which means that oftentimes people will very often see low sodium level, especially in the elderly population. And doctors don't quite know why exactly the sodium is that low. But another reason why sodium can be super low is due to other diseases as well. So there's a lot of diseases that can bring the sodium level down low. And also a lot of the time it's also just due to the person. So if you drink way too much of water, and it takes a lot, you will drive down the sodium level. So far, a lot of times, if you have the sodium levels that's too low, a lot of the treatment is just cutting down on water intake. Stop drinking too much water, because if you drink too much water, it actually dilutes the electrolyte inside your blood. Because it's just like if you have a cup of water and you dissolve some salt in it, all right? If you have a little bit of water, the taste is really like salty. But if you add more water, it tastes less salty, right? Same concept in your body. So a lot of time when it comes to low sodium in our body, we have to figure out what's the cause, right? If it's the medication problem, we can try to change the medication. If it's a disease, we can try to treating the disease. If someone has low sodium just because they are drinking too much of the water, then it's easy. The solution is easy there. Just cut down the amount of water that they're drinking. Okay? Like this video if you learn something, and share this info to those who drink too much of water. I mean, it's really too much water, so they have a low sodium. Okay? Today, Kim Loh, is going to share about how to prevent hypertrophic cardiomyopathy. Before I continue, subscribe my channels and turn on the notification bell for further knowledge. We upload videos every week, every day about testimonials, disease, myth, a lot of different health topics. So, hypertrophic cardiomyopathy. Let's break this down. Hypertrophic means thick. Cardiomyopathy means disease of heart muscle. So, what that means is that most heart diseases that happen is that when we have loose muscle weakness, we have our heart muscle and they can't pump properly. So it's kind of like frittering. It's not giving the strong pump that need for the muscle than the heart muscle need. Okay? For most of the heart diseases, it's like that. Your heart muscle is too thin. It's weak. You had a heart attack somewhere. So part of this heart muscle is like scar tissue, it's not muscle, all right? But with hypertrophic heart disease, what happens is your muscle wall is too thick, okay? You have too much heart muscle, and people might think, oh, isn't that a good thing? Don't you need muscles for your heart to pump? Right. What happens with hypertrophic cardiomyopathy is that you know that you have a lot of muscle there, okay, in your heart. What happens is then that your heart can't rest properly. If your heart cannot relax, it cannot rest, that means that your heart can't refill with blood. And if your heart doesn't refill with blood, it's not pumping properly, right? So, there's two components to your heart disease. The functioning of your heart. The first one is that your heart must be able to relax properly. It has to be able to fill up with blood. And then, after you fill up with blood, then it has to be able to pump it out all. Okay? Most heart diseases is the pumping problem, which causes the problem. But for hypertrophic heart disease, the main problem is it's not filling properly. And if it's not filling properly, you still get a problem because your heart can't function. They can't function properly, right? Hypertrophic heart disease is type of the heart disease that you know that people always link it to the athlete, okay? Those athletes, you know, they work out super hard. Don't go super hard for yourself. You know, those athletes, they're always working out there, they're running, they exercise, they do weightlifting. They are growing muscle everywhere. But if you are work out your heart too hard, you are getting what we call the hypertrophic heart disease, which is too much heart muscle. Now, there may be a genetic component of this. Some people just end up having it. But for all of these things, it's just about, you know, doing everything in moderation. You know, I always say that think that like exercise. Exercise is healthy for you, but it's also need to do it moderation as well. For people who go super hard, they work out too much, it's going to be some pretty bad health effect for you. They are going to lose too much of fat in their body. That's also unhealthy for you. You're going too hard for your joint. A lot of professional athletes, they end up have a joint problem later after their life because they are way too hard on their joint. They're walking too much, they're running too much. It's probably worth it for them, but they do end up with other health issues later on in their life. Or you might end up with other health issues somewhere else in your body by working it out too hard. But with some people, they just end up having it, and we are not quite sure why. There may be because of the genetic component in it. It may be because, they were going too hard at it. But when it comes to this sort of heart disease, it's an interesting one because it's considered too thick instead of too thin. But for most people, when it comes to preventing heart disease, the vast majority of heart disease is what we call coronary artery disease. So your heart has its own blood supply, okay? Which is your coronary blood vessels. Because like every other muscle in your body, you need oxygen. Your muscle need oxygen, your heart need oxygen as well. So every time your heart pump out, it also pump out itself its own blood supply. So it pump out the blood going into the coronary vessels that feed the muscles of your heart. So the vast majority of heart disease happens when the vessels get blocked. And when these vessels get blocked, it means that your heart muscles isn't getting enough oxygen, okay? So you can do this kind of experiment at home by yourself and see how do you feel. If you tie something on your arm, and tie really, really tight around your arm, prevent the blood going through your hand, prevent getting there. And just make a fist. I make a fist really, really fast, like this. Like, keep going. Or squeeze a stress ball. After a while, your muscles really start to itch. It start to get really hurt, okay? And if you just let it off, the tie, let it go, all of a sudden, all the pain will go away because your muscle is suddenly being resupplied by oxygen. But it's the same thing with your heart there. Those sort of pain that come with the heart attack is because your heart isn't getting enough oxygen. It gives you that kind of pain, just like when you tie your arm. But your heart is unlike your arm, it's different. If you get your arm there, you can just stop it. You can just stop using. But your heart, it can't stop. So all that happens is that you get the sort of pain, but your heart cannot stop. It need to keep going to keep you alive, right? It has to keep going. So what happened then is that your heart has all sorts of ways to get around it. It might form a new vessels. Or you start getting issues with your heart muscles dying off because you are not getting enough oxygen there. So your heart starts to dilate because your heart muscle die off. So if you got the scar tissues on the muscle, on the heart, it can tie up. It doesn't contribute to the pumping of your heart. It can actually interfere the function of your heart. So the best way to prevent this coronary heart disease is through diet and exercise. One of the main contributing causes to the coronary heart disease is your diet. You have too much cholesterol, you are eating too much saturated fat, you are eating fried chicken every day, you are not exercising, you are gaining weight, and if you are having other diseases like diabetes or you smoke, you are just increasing the risk of coronary heart disease. So it's all these sort of lifestyle factors that we can all prevent. The number one killers in the world, something that a lot of us can really prevent it. So it's all come down to the diet and our exercise. We want to focus on our healthy diet. We want to eat more plant food. We want to eat more vegetables, more fruits. When you go to the supermarket, your shopping cart, you should have colorful mass of fruit and vegetables, and maybe, a tiny corners with your meat. But the vast varieties of your diet should be fruit and vegetables. And you should be getting moving, getting exercise every day. I'm not saying that you have to run a marathon, but start with something small step, moving every day. There's some research showing that just sitting around every day is as bad as smoking a pack of cigarettes. So we want to get up, okay? Let's get up. We want to move around. Just walking a little bit is good enough, okay? And if we just walk around a bit more, you might find that you're starting to exercise more. So get the ball rolling. Do more and more exercise. And if you have other diseases like diabetes, it is super important to get it hold of your blood sugar, because diabetes is a significant contributor to not only blocking your heart muscles, but blocking the vessels in other areas of your body as well. And if you smoke, you should really stop smoking. So now you know how to prevent heart disease. Hey, Kim Loh here. I'm going to talk about one of the myths of cardiovascular system. If patient flatline, the doctor should use a defibrillator to save them. Comment below if you have seen that on the TV or the movie before. You have seen those shows, like beep, 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 and everyone's going, oh, we're losing him, we're losing him. You know the scene that a patient is flatline, the doctor shout and yell out, clear, and then jab, clear, a jab, like a big electric shock. The patient a back edge and came out, and then it comfortably beep, 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 come out back. And the patients wake up, and then they can work, and they can talk, they can speak, okay? This is entirely 100% wrong, contrastly to popular belief and most TV show and movie out there. You cannot shock everyone back to life, all right? If you look at the heart rhythm, you can group them as shockable and not shockable, okay? If you look at those green waves, okay, there is a measure of the electrical activities of your heart. If you see the waveform goes crazy on the monitor, it's usually shockable. But a flat line, it's not, all right? You can think it's like a computer. A defibrillator is like forcing a frozen computer to restart. After the restart, the computer is getting back to normal. But a flat line means that the heart doesn't have any electrical activities. It's not moving. It's not pumping, okay? It's like if your computer is completely unresponsive. The monitor shows nothing but just blackout, okay? You can just hold down the button all you want, but nothing's going to happen. If you have someone who is flatlining, the only treatment, the choice, is to continue to do the CPR. Because at that point, CPR is the only thing to move the blood through the bodies and oxygen to the brain. And you also want to give them a huge dose of adrenaline that hopefully will kickstart the heart. It's like plugging a powerless computer back to the socket. Give them the power, okay? Give them the blood, give them the oxygen. So now you know when next time you see doctors on the TV show or movie, they're shocking the patient with the flat line, you know that is completely wrong, okay? Why would our pulse suddenly increase even we do nothing? Should we be worried if it spikes randomly over 100? Comment below if you have this kind of question before. I'm Kim Loh. If you haven't subscribed our YouTube channels, do it now, because we do have new videos about disease, health, myth come out every week. Okay? So sudden increase in your heart rate, right? Your heart rate is not stable for most of the time. It's always go up and down. That's all right, okay? And it's not just respond to exercise. It can go up and down, respond to your emotion state. If any of you wearing the heart rate monitors and you go to watch a horror movie, where you look back into the record and you will find out, you see your heart rate is going up and down, okay? Yeah. So it's actually okay and it's perfectly normal, all right? But if you get all time of this random spike to 200 beats per minute, 300 beats per minute, 100 plus beats per minute, and you are worried that it might be something that you can always go out there and check out by the doctors, because there is a heart condition, what we call atrial fibrillations. A lot of people think that atrial fibrillations mean that you have an irregular heartbeat all the time. But for some people, it comes and goes. You know, sometimes the heart rate is normal and then suddenly they might have a spike in the heart rate. When it's like come and suddenly increase, irregular heart rate, that is real. But you can go to the doctors and have a checkup. How they usually check this out is that they will have you to wear this kind of one of their advanced heart rate monitor for a period of time. So hoping to catch the rhythm in the actions, all right? But for most people, we can just think that other cause might have caused it, like are we reading something that on the internet, or we just see a post that made you feel like, wow, scary, or something like this. Wow, what is that? You know, like something you do that there's a lot of things that contribute to your heart rate going up and down, okay? If you are concerned, you always can go back to your doctor and tell them, hey, doctors, I noticed this happened to me, and they might recommend you to wear a heart rate monitors, and hopefully to catch those abnormal heart rate in action and see whether it's something that is concerned about, or is just your heart rate increasing. It's normal. Okay? So now you know the heart rate increase might not be a bad thing. Okay? Share this to someone who you know. Remember to subscribe and turn on the bell so that you get the notification for new videos that we upload every day, every week. Okay? I'm Kim Loh and see you soon.